Good afternoon, welcome to the Keystone Chiropractic Blogcast. So today we're going to be talking about a symptom that's very near and dear to a lot of people. We're talking about neck pain. Now a lot of people know that I work almost exclusively with the mechanics of the head and neck, and that's where a lot of my training comes from, and using the NUCCA protocol and doing structural chiropractic care is working on the head and neck. Now the head and neck is important for lots of things in the body, primarily the brain and the central nervous system, but it makes sense for a lot of people when they know that I work exclusively on the neck, that there's an idea that I probably have a unique focus or have an expertise when it comes to the cervical spine. And one of the most common things that people have problems with when it comes to neck pain is that it really limits their ability to do a lot of their everyday activities. And probably the most common complaint is, I can't turn my neck when I'm driving. Now, a lot of people have woken up with a stiff neck when they get out of bed, and it causes a lot of problems. And that's also one of the chief complaints, is I can't turn my head. And imagine having that feeling when you can't turn your head when you're trying to drive, but you have to do that every single day of your life for years. And that's what a chronic neck pain patient is like. For a lot of people, it may come down to the fact that they have a herniated disc in their neck, or a disc protrusion, which basically means that the discs in their head and neck have actually been reduced to the point where the disc pushes out and it's pinching on the nerve. And for those situations, sometimes you just need some time for that disc to settle down and for the inflammatory process to stop. But once you get to a chronic stage, and obviously there's a problem that probably needs to be corrected. When we look at the head and neck, we should see a nice C-shaped arc to it. We should see healthy disc spaces put throughout the neck. And when we look at the head and neck, someone should be able to hold their head and neck straight through. A lot of people, when they come into the office, they'll notice that their head and neck are actually tilted off to one side or the other. We also see some abnormal twisting or rotation of their head and shoulders. And those are all common signs that a shift in their head and neck, or a structural shift in their head and neck, is actually the problem. Now, what has to happen is that neck has to hold up a 12-pound ball called your head on top of it. And when that 12-pound ball is leaning to one side or the other, it's going to create abnormal stresses to the muscles, discs, and ligaments. And the only way that we can reverse that is to get the head repositioned back onto the neck properly, and then allow the body to be able to heal itself again. So one of the things that people have to do is you have to identify what the pain source of their neck pain is, how long it's been there, and we have to screen them to see if structural chiropractic and NUCCA is actually going to help them. And once we figure out those things, then we can figure out if this is a likely source to be able to help them overcome chronic neck pain.